name is Camilla and welcome to our class. Today both Emily and myself will be speaking to you about hepatitis B and vitamin K administration to newborns after birth. We will be discussing what they are, the benefits, potential side effects, and of course why they are given.
Hi, I'm Emily. Welcome to our childbirth education class. The aim of our presentation today is to inform parents expecting their first child and those attending this antenatal class about the hepatitis B vaccination and the vitamin K injection for the newborns after birth. So, hepatitis B, what is it? Hepatitis B is a DNA viral disease that primarily affects the liver. It is contagious and it's passed from person to person via blood and body fluids. The virus replicates in the hepatocytes of the liver and may lead to liver dysfunction or liver cancer. Children who contract hepatitis B are more likely to develop liver disease or cancer later in life. All children should be immunised against hepatitis B, as well as adults who are at an increased risk. How common is hepatitis B? Well, globally, it's a major global health issue. It affects approximately 240 million people worldwide, and over 680,000 deaths occur annually due to complications of hepatitis B worldwide. In 2010, in Australia, 170,000 people were living with chronic hepatitis B, with 335 deaths due to the disease in the same year. It's becoming more prevalent in Australia as well. Who does hepatitis B affect? Babies can contract hepatitis B from their infected mothers during the time of the birth. They can also contract it unintentionally during their early days of their life from other members of their family, people in the community, daycare facilities and friends. In Australia, groups with a higher prevalence of chronic hepatitis B infections include people who inject injectable drugs, Aboriginal and Torres Strait Islander people, migrants from other countries that have hepatitis B endemics, and also inmates or people who have been in correctional facilities are also in a higher group of having hepatitis B. Signs and symptoms of hepatitis B don't usually appear in newborn babies and children until the disease is advanced, and it's usually 3 to 4 months after they're being exposed to the virus. So the babies are usually asymptomatic if they have picked up the hepatitis B virus. But the late signs and symptoms can include a loss of appetite, fever, tiredness, pain in the muscles, joints and stomach, nausea, vomiting and diarrhoea, dark coloured urine and yellow skin and eyes. So how do we vaccinate the newborn baby against hepatitis B? We give the babies a small injection into their thigh. It should be administered within 7 days following the birth, and it's usually done while the baby is still in the hospital after the birth. The baby also requires further immunisations at 2, 4 and 6 months, and this guarantees maximum protection against hepatitis B. So the vaccination itself is pretty safe to give to the newborn babies. It's not a live vaccination, and it provides protection without causing any disease. It's produced in yeast cells and it's free of animal and human blood products, and it doesn't interfere with any breastfeeding at all. So what are the side effects of having the hepatitis B vaccination? The babies may get a small red lump at the injection site. They may get a low-grade fever or temperature. They can become unsettled, irritable, cry, drowsy or tired, and sometimes they can get a more exposed lump over the injection site, which may last a few days or up to a week.
So, what is vitamin K? Vitamin K is a fat-soluble vitamin that is found in both you and I. It is necessary for blood coagulation, therefore it prevents excessive bleeding and the consequences that are associated. Adults receive vitamin K from both diet, and it is also made in bacteria found in the intestines in the gut. Why do we give vitamin K to newborns? At birth, your child will only have a small amount of vitamin K within their bloodstream. So this is due to the fact that vitamin K does not cross the placenta and their gut does not yet have the bacteria that makes it. We also give vitamin K as breast milk contains only small amounts and their gut has not had the time to commence making it. So how is vitamin K given? Generally, it's given via intramuscular injection in 3 doses. The first is given at birth, the second is given approximately 72 to 120 hours post-birth, and the third is given orally at 4 weeks post-birth. Due to the fact that vitamin K has been added to certain formulas, formula-fed babies may not require this third dose, but this will also be followed up. So after receiving each course, the midwife will document this in your child's health record for future reference. And just like any injection, afterwards your child may have some soreness and bruising at the site, but this will subside very quickly. What can occur if you choose not to administer your child with vitamin K? So as I said, vitamin K is used for blood coagulation. Therefore, if you do choose not to, your child is at risk of severe uncontrolled bleeding for a period of 6 months, as this is when they have established a level that can control bleeding. So it can be significant and range from happening in the GI tract, nose, stump, and in severe cases, it can cause irreversible brain hemorrhage, causing brain damage, and in very severe cases, it can cause death. So as a parent, you may be wondering if you have a choice whether or not to give your child both vitamin K and hepatitis B. And the answer is, of course, you do. But as health professionals, it's our duty of care to ensure that you have made an informed decision and that you know that all the risks are involved. So after receiving evidence-based information from both midwife and GP and or obstetrician, if you do still choose not to, you will then have to assign a refusal of treatment form. After hearing this, you may be wondering where you can find some more information about these topics. So of course you can ask your midwife, you can ask your GP, obstetrician. The Vic Health website has some really good information on there. The National Health and Research Council and also the Australian Immunisation Handbook are some really good resources for you to use.